Over 1 million Rohingya refugees live in shanties on the Bangladesh-Myanmar border. These camps have all the characteristics of a potential hotspot for an outbreak. They are overcrowded and there are limited medical provisions. What people there can do is the most basic way of protection.
The organizations working here informed us about cough, cold, and sore throat being the symptoms of coronavirus. We've been told to be aware about this.
The situation in neighboring India is very much alike. Slums in Mumbai, which are home to around 1 million people, reported their first coronavirus case on April 1st. It raised fear about more infections, and many believe the city is sitting on a ticking time bomb. The pandemic is also threatening vulnerable communities in Brazil. In the beginning of April, Brazil reported the first case in an Amazon indigenous group. The country is home to an estimated 800,000 indigenous people from more than 300 ethnic tribes. Experts say those people are particularly vulnerable.
It's a major fear that this disease arrives, causes an outbreak in the indigenous communities, and ends in a mass genocide. It's a very dangerous situation the Brazilian government must prevent.
But the Global Health Security Index says the world's most vulnerable region for an outbreak is Africa.
I want to take a moment to highlight Africa, where we're seeing the spread of the virus to rural areas. We're now seeing clusters of cases and community spread in more than 16 countries. We anticipate severe hardship for already overstretched health systems, particularly in rural areas.
Pandemics can cripple fragile healthcare systems and harm economies. In today's interconnected world, it is important for international communities to get together and help vulnerable regions fight the pandemic. Cao Bing, CGTN.